Together, we have seized this opportunity and leveraged our existing networks to build something new, something more strategic, and something more promising.
There are few examples where the multilateral partners led by WHO have converged their actions.
Taught us the power of coordination and collaboration to serve humanity, not only on the national levels, but also on the international levels.
Commitment of 12 multilateral agencies for SDG GAP is an excellent idea to help signatory countries accelerate progress as part of a decade of action.
What we did in Jordan was very, very clearly to say upfront, together with all partners, and I'm not speaking only the United Nations, but all partners, and particularly, if I may say so, the big bilaterals, and together with the government, saying that, no, we're not going to create anything new. What we're going to do is to build on what is in place.
We have the country coordination platform as a way to ensure accountability for all partners for the results identified in the investment case. To ensure that there's an efficient process. We feel that a less fragmented partnership, a less fragmented partner landscape will certainly result in a less fragmented financing landscape and will result in greater efficiencies.
We are supporting the government of Morocco as one. It's very hard to tell where the support of one agency ends and the other one starts. And of course, this all puts the priorities of the country at the center and the people of Morocco as the objective.
GAP helped us integrate the notion of acceleration to speed out our actions, but also accelerate and the movement and guide the dynamic for our joint work at country level.
Within each of these accelerators, already agencies have more or less a division of labor. There's been an agreement on how, let's say, for financing, WHO, the World Bank, and UNDP will be working together.
The GAP agencies have committed to transform oxygen access gap in Somalia through a range of innovations. Lack of oxygen access is a matter of life and death. Scaling up the availability of oxygen at the primary healthcare level using solar power can save thousands of lives of the children in Somalia.
The agencies and governments together in favor of a substantive response, not only to contain and overcome the pandemic, but to address the foundational barriers of inclusive recovery and what we like to term building back better.
This was the year of the partnership, I would say. We all suffer from the COVID pandemic, but let's take up these opportunities together.
It is very important that if we can leave our egos at the door and actually start collaborating in a real fashion, that there's so much more that we can do.
The Global Action Plan for Healthy Lives and Well-being for All is the right platform for the multilateral partners to coordinate, cooperate, align, and leverage actions for health, which is a global public good.